I've had a letter from a person who's talking about their spouse who works in the airline business, and they were based here in the Isle of Man. Now they're being based out of Belfast with another company, but they're really suffering, they say, because every time he comes back, he has to go through the two weeks, and the whole family technically has to go through, if they want to be together. Yeah. The children have to come out of school, the whole thing. Is that really right? I mean, wouldn't he not be a key worker to some degree? Or because he's working off the Isle of Man, he's not our key worker?
Well, as a pilot, which I assume
yes,
what you said
he is.
He's a pilot.
Yeah.
As a pilot, he should qualify for the UK key worker pathway, which allows them access to 7-day in test. So he would still have to isolate, as would the family, for the first 7 days, but then it gives, after the test, if it's clear...
So has it wrong advice? Wrong advice, or being told something wrong? Or does he need to check it with
He needs to check, I think. He needs to get in touch with the Cabinet Office team, which can be done via tns@gov.im. And actually raise that with them.
Now, the Cabinet Office are responsible for all the data for people when they return, that sort of thing. I've heard there's a problem between the police not having access to that because there's a breach, and you love your data protection thing. I mean, yet they were sometimes asked to go and check on something if a neighbour rings in, but the police aren't getting necessarily automatic access to that list. Do you feel that's the right thing to do? Because they've got to get permission?
Well, that's data protection laws. There's got to be a precise reason why it is shared. If people have concerns or breaches, yes, they can report them to police, but there's also obviously the phone line they can report them to, which then gets referred to the Cabinet Office, and if necessary, it's then referred onwards to the police.
I mean, I know the police aren't going around particularly checking, as they're not the front line
it's
to do it.
done by the Cabinet Office who holds the data.
But if there's a breach, the police have to be brought in, don't they?
Yeah, but that would be done by the Cabinet Office team once a breach is identified.
So someone ringing the police to say, I think someone's not isolating, that call goes to the police, but then the police then have to read that to the Cabinet Office.
They have to relay to the body that actually has the information. It's the legal requirement. Otherwise, people's data protection would be being held by the police who've committed no crime and not committed any offence. And I don't think the Information Commissioner's Office would be too happy around that.
How are we doing? I mean, we heard about that one big case. This was a jet ski, by the way, we didn't mention at the very beginning, coming over to the Isle of Man. 4 hours or something it took them to get here. Are there other incidences going on that you're aware of? I mean, would you know about them, for instance?
No. I mean, that I think is a very rare case. I mean, I'll be honest, you can't knock the person for perseverance. I think 4 hours on a jet ski.
Someone on a trawler, maybe, I don't know, or just...
The ports are controlled in that sense quite tightly about boats coming in, and the Minister for DEFRA has spoken before about how they're going to deal with ships landing their catch, and how there has to be restrictions around crews being able to come onto the island under the current restrictions.
Any signs of any movement? I mean, the UK is going down, aren't they? Is it 5 days? What the last one I heard?
10 days.
10 days.
From 14
from
to
14. We going to go anywhere?
No, we're not planning at the moment to mirror that. The reason being that it doubles the risk of someone coming out of... Going from 14 to 10 doubles the risk of someone coming out of isolation at the end and still being infectious.
What, from 14 down to 10?
10 doubles the risk.
But at 14 there's still a risk, isn't it, basically?
There's always a risk with a virus. Everyone reacts differently. There's people around the world, very, very rare cases, I have to say, one in millions of people who've tested.
Yeah, so doubling it from very, very small to that, it's headline doubling, but it's still a very low risk then, isn't it?
No, it's still a doubling
but everything's
of
a risk,
the risk.
Isn't it? I mean,
and that's one of the... But when you've got a community that has no community transmission, that has no localised transmission, that's a very different situation to a country that already has that transmission going on. So the risk of us going from 14 to 10 is a very different risk from the UK going to 14 to 10, because they are adding simply risk to the risk they're already carrying because they've got an ongoing pandemic. We haven't.
By now, we should be hearing all about the students who are returning and this big fear that's been going on. Although we're now at 3 or 4 cases of active cases. Is that right now? Can you give us anything on that at all?
Yeah. There were the 3 cases that they've all travel related. As far as I'm aware,
you'll give me an age range then.
As far as I don't have that.
No.
I don't get given the individual age ranges because I'm not entitled to that information. I'm just given a broad range when we have a large number of cases. In relation to it, though, my understanding is none of the 3 are students.
Right. All found through the system again. So they've got off their plane or boat, they've gone home, they've been self-isolated, and then they sniffle or something happens.
They've produced symptoms, gone for testing, come back as having been positive.
And again, so if you didn't sniffle whatever, you just do your 14 days, but you're still actively thing, because those people who do sniffle, they start their 14 days again, don't they?
Yes, they do from that point.
But these people who don't know they even got it,
no,
don't.
they would carry on with their 14 days. But as I just discussed, 14 days isn't a catch-all, but it is the most safe way, and most people will be well over.
But if you were sniffling, why should you also start the 14 days again? Because you're exactly the same as that other person, aren't you? It's just that you're showing it and the other person isn't.
Well, people are responsible, Paul. And also, if you are positive, you want to know you're positive, because if your situation deteriorates, you need to seek medical treatment.
Mm-hmm. Going out for this hour exercise is still causing some people concern. If you see someone with a mask on, should you keep absolutely well away from them and that sort of thing and be responsible, assuming that they are somebody that has got to their hour out in the garden or whatever it is, or on
Well, the first thing I'd say is people shouldn't be treated as lepers or second-class citizens. These are people citizens in the Isle of Man. You don't know the reason they've been travelling either. I have unfortunately heard of people getting abused for travelling, but they may have been for funerals, they may have been for various other reasons, they may have been for health reasons. So it's important we do show respect to other people. There is the rules around the 1 hour exercise. You should only be with members of your own household. You must maintain 2 metres apart. You can't use it as an opportunity to nip to the shops or something like that. That will put you in breach. We had that in the early days of the pandemic, where people were able to exercise, and so far it's been without issue. And
key workers, just finish on that one. You had to have another look at it. I think Tim will ask to see if these so many people that were coming in were needed. Is that review still ongoing, or have you just cut back?
No, the review has concluded. One of the things we've got to remember, which was explained when the question was asked, I can't remember if it was Keys or Tynwald now.
I think Keys.
It might have been a Keys one. Around the key workers, was that not everyone who's been issued a key worker exemption actually comes into the island. So in fact, I think when I did a supplementary to that question, because the question was to the Chief Minister, I pointed out that in health and social care, for instance, we have the oxygen deliveries from the UK. Well, all of the oxygen delivery drivers hold an exemption certificate, so they're included in that number, but they don't all come over. It's one person and a wagon that comes over.
To finish on the side, back to hospital and elective surgery, which was stopped, wasn't it, for that while? Where are we up to? You've been talking about it in Tynwald now. Can you explain where we're up to?
Yeah, so elective surgery in relation to trauma and orthopaedics, where people require an overnight stay, is currently suspended.
Still?
Due to the bed pressures. The day cases, so people who don't require an overnight stay, they are up and running. We are carrying on with those. Clinics are going on as normal, but unfortunately we do need to, due to the pressures we're seeing within Nobles around beds, do this temporary suspension.
How long is this going on for?
So, as I announced this morning in the answer to the questions, it will be reviewed on the 4th of January.
So there's a lot of people that already were held up anyway, who've been held up again.
And then there is various things we are looking at that when we started back up to try and tackle that suspension, including additional resource to try and cope with that.
What, extra people? It's manpower, is it, basically?
And the other thing we need to make clear is that severely urgent cases, as in life-threatening, will still take place.
Mm-hmm. And flu levels are presumably still low, are they?
Yes. So
but asking people to get their jabs?
So we are still asking people to get the flu jab for those that are in the categories, and I think that's important that people do take that.
And we look forward to you having your jab on camera.
Yeah. Well, I'm not in any of the current age ranges, but I have said quite clearly I would be more than happy to.
I'm ahead of you.
Vaccine.
I'll get mine done. I don't mind.
More than happy.
There's always this thing going to go on, isn't there? People are really worried about should they, shouldn't they? It's the anti-vaxxers sort of thing. Any message?
Yeah, I think people need to make their own decisions, but I really would urge people, look at the actual evidence, not the fake stories going around Facebook and other social media platforms. Look at the evidence of people who've had the jab already, the low risks that have come out of that. But at the end of the day, people do need to make their own decisions. We're not going to make it mandatory. And just to be absolutely clear, and I've asked you this before you say that, when these other vaccines come online, people do not have a choice. They will be told you're booked for an appointment and what you get is what we give you. Yeah, you will get whichever vaccine is available at that time.